So it is my pleasure to share with you the key insights from the PIDS-UNICEF book, Raising the Bar, Understanding and Solving Chronic Malnutrition in the Philippines. So as I mentioned a while ago, this book is a compilation of the years of research by the PIDS in partnership and with support, of course, from the United Nations Children's Fund Philippines for the Philippine government, and brings together the research of around 20 chapter authors across 8 chapters, woven into a coherent narrative under the lead editorship of Dr. Val Ulap. Okay, so to start, we anchor in this presentation our synthesis on the UNICEF's conceptual framework on malnutrition. So this framework helps us understand what determines malnutrition and how different systems interact, influencing maternal and child nutrition. So the immediate determinants, including the child's diet and care, explain whether children are eating enough and receiving appropriate care and feeding. Next, the underlying determinants, including our food, practices, and services available to children and women in their households, communities, and environments, enabling the good nutrition in the form of the good diets and care. And then lastly, we have our enabling determinants, which are the political, financial, social, cultural, and environmental conditions that enable good nutrition for children and women. So this is organized into resources, governance, and norms. We use this framework to map key insights from each chapter of the book and trace how the different determinants connect to nutrition outcomes. We begin with our outcomes, which is the chronic malnutrition and child food poverty. So a child's height or stunting status, according to many empirical studies, is a strong determinant of human capital and a predictor of economic productivity. In the Philippines, the prevalence of under 5 stunting has generally been declining over the years. So in 2023, the recent results of the National Nutrition Survey noted that 24% or around 2.2 to 2.6 million children under 5 were stunted. But looking back over 3 decades ago, this was almost double. However, the Philippines had to settle with around 0 to 1% average annual decline, which is still above the average stunting prevalence for upper middle income countries, which we are slowly transitioning into. Still, while it declined, stark inequalities still persist, and this slow progress is reinforced by the large inequity across socioeconomic classes. So as mentioned also earlier, in 2023, around 4 in 10 poorest households suffered from stunting, while only 1 in 10 of their richest counterparts were stunted. One important root of these inequalities lies in what children eat. So many Filipino children, especially those from poor households, fail to meet the minimum standards for diet diversity and frequency. So we've noted in our analysis that 62% of Filipino children do not meet the minimum dietary diversity, and in terms of minimum acceptable diet, only 35% among children from poor households meet this. This food poverty in children fuels also the persistence of malnutrition and contributes to the inequalities. Given our problem on chronic malnutrition and child food poverty, we deep dive into each factor that could be attributed to this. And then first, on the immediate determinants or good diets and care. Good diets and good care go hand in hand. So unequal access to this leads also to unequal child health as well. So our analysis from the chapter 4 of the book shows that there is a socioeconomic gradient on the burden of diarrhea, which is usually an indicator of poor health or infection. So in 2021, we've seen that children from poor households were 3 times more likely to be experiencing diarrhea compared to their affluent counterparts. So we all know that exposure of children to infection suggests that there is an increased susceptibility to illness and reinforces the need for them to access primary care services. However, the NDHS 2022 reports that among the children with diarrhea from the poorest households, only 32% was able to seek treatment. And further, around 20% of individuals who experiences diarrhea did not receive zinc and ORS, and we know that persistent of infection affect the body's ability to absorb nutrients, hindering their growth and development. So given that, we ask the question, what could be the cause of these issues or inequalities? And to answer that, we go back again to our framework and discuss the state of affairs in the following components of this framework. And we deep dive now on the underlying determinants. So these underlying determinants, which are the foods, practices, and services, shape diets and care, influencing our outcomes. And we will discuss this through the water, sanitation, and hygiene, food systems behavior, social protection, and food systems environment. Okay. We start with water, sanitation, and hygiene. So to achieve quality care and services, the diets of children, including drinking water, should be, of course, safe. And furthermore, the sanitation services in the environment should remain optimal to prevent diseases. In the Philippines, wash coverage appears high overall. However, the last mile areas tell a different story. The persistent open defecation and unsafe water in last mile areas drive infection and diarrhea in children, perpetuating the infection malnutrition cycle among the poorest children. Our analysis in the chapter 4 of the book revealed that in Quezon, Masbate, Samar, Negros, Lanao, Basilan, Sulu, Mindoro, and Palawan, approximately 4 in 10 children under 5 are practicing open defecation, and these areas are usually far-flung and are not consistently reached by our usual health and nutrition services. Overall percentage of the population accessing surface water or unsafe water remains low at around less than 1%. However, when we look at the last mile areas, including Barm and Mimoropa, this rises to 10 to 50%. Next, in terms of services, social protection particularly, these social protection services, we are expecting that these can improve child's diet and care by helping improve the household's access to food, health, and care resources. And this is exactly the objective of the country's flagship poverty alleviation program, the Pantawid ng Pamilyang Filipino program, or 4Ps, or our conditional cash transfer, aimed to improve the human capital of children in low-income households by investing in their health and nutrition, as well as their education. So findings from our analysis, as you can see in the chapter 6 of the book, revealed that while 4Ps contributes to poverty reduction and health-seeking behaviors, evidence supporting this positive impact of 4Ps on children's nutritional state is inconclusive, similar to global experiences in conditional cash transfer programs. This lack of conclusiveness and I mean this lack of conclusive evidence may be attributed to several reasons, such as program design, implementation, monitoring, contextual factors, and other unwanted effects. Next, we discuss another component of the underlying determinant that shape children's diet and care, which is the food systems. A component of this are food environments, which refer to the individual and household level factors that consumers bring to the food environment, such as purchasing power, access, convenience, desirability, and these inform why people choose to procure the foods that they do. In the Philippines, we have issues on accessibility, including affordability and availability, and this is discussed in the chapter 5 of the book. In the Philippines, we've noted that there is a high food expenditure shares among the poor, which limit their access to nutritious diets, highlighting the deep inequities or inequalities in food affordability. Filipinos, on average, spend about 43% of their expenditures on food, and the poor allocate the highest share, which is about 65% of their expenditure on food, higher than the allocation on food of the middle income, or more than doubling that of the rich households. So with the significant income of our households going to food, families may already struggle to secure adequate nutrition for their children, potentially limiting their ability to budget for other necessities such as healthcare and education. Food affordability also drives inequalities in consumption across income groups. As wealth increases, so does the consumption of protein-rich sources and fats and oils. Meanwhile, poorer households depend on cereals and cereal products for majority of their daily consumption. And many children in the Philippines suffer from malnutrition due to this inadequate consumption of protein-rich foods, which are vital for addressing this issue, but are often unaffordable for most families. This disparity may be attributed to the escalating food costs relative to income levels. And furthermore, in the chapter 5 of the book, we discussed also the widespread consumption of ultra-processed foods, which is increasingly normalized in the Philippines, driven by affordability, availability, and as well as the aggressive marketing tactics by the food industry. In terms of the behaviors and practices surrounding maternal and infant young child feeding, we've noted the gaps in the correct knowledge and practices that these deepen also the inequalities in child nutrition. The national data shows that more than 3/4 of the mothers consume unhealthy foods and beverages. And furthermore, there are substantial gaps in breastfeeding knowledge and practices. We've noted that awareness of exclusive breastfeeding duration is lowest among the poor mothers, around 40%, compared to 30% among the richest. And then, in addition, recent data alarmingly show that there is a decline in appropriate IYCF practices that was observed in recent years, despite the Philippines being among the best practice countries for IYCF and the gains that we have been able to achieve recently. So a deep dive on IYCF practices shows that nearly half of the children aged 6 to 23 months consume unhealthy foods, and around 1 in 3 children do not usually consume fruits and vegetables, reflecting deeper systemic and food environment issues. So we've discussed the outcomes, the immediate determinants, and the underlying determinants discussed in the book. Now we move on to discussing the enabling determinants such as nutrition, financing, and governance. In terms of nutrition financing, at both the national and local level, nutrition financing remains fragmented and incoherent. So these insights are discussed in chapters 3 and 7 of the book. At the national level and at the local level, at the national level, nutrition-related spending in 2017 to 2019 reached 492.7 billion or 1,554 pesos per capita, equivalent to less than 1% of GDP and 7.9% of total government expenditure. At the local level, our analysis revealed that financing remains skewed, fragmented, and unpredictable due to the absence of the mandated budget for nutrition and local governments. And further budget allocation and expenditures are often shaped by local politics and the mayor or the local chief executive's priorities, leading to variability or inequalities in the implementation of nutrition programs across the local government units. And at both levels, the national and the local level, we've seen that spending is mostly for the nutrition-sensitive program with limited support for nutrition-specific and very little to enabling interventions. And we've also noted, as discussed earlier, that the allocations usually misalign with the first 1,000 days continuum. Okay. And in terms of governance, we have the Philippine Plan of Action for Nutrition, or the PIPAN, which guides the country in addressing maternal and child nutrition. In chapter 7 of the book, the evaluation of the PIPAN 2017 to 2022's implementation was discussed. So our analysis revealed disjointed national governance and inequalities in local implementation hinder or undermine the delivery of nutrition programs. So while the regional and city municipal governments recognize and integrate the PIPAN in their plans, in their investments, implementation remains unequal and variable at the barangay level or the level of government who are expected to deliver some of the nutrition services. Moreover, program priorities and implementation often depend on the local chief executives and are limited by the availability of the human resources at the local level. So we know that good governance at all levels, particularly under the guidance of the national government through the National Nutrition Council, is crucial in ensuring the seamless integration of all the key actors and implementers of nutrition intervention. So we were able to discuss each factor noted in this framework and each key insight from each chapter of the book, exploring how various enabling, underlying, immediate determinants discuss their influence maternal and child nutrition, specifically chronic malnutrition. Summarizing this, we emphasize that chronic malnutrition is the sum of unequal systems. The evidence presented in the book is clear. Chronic malnutrition is not a single sector failure. It is a cumulative result of weak linkages across food, health, WASH, social protection, governance, and financing system that should together ensure good diets and care. Raising the bar demands breaking silos, addressing inequalities, and advancing comprehensive, continuous, and convergent strategies that weave efforts across all sectors and levels. So this requires leadership that bridges together various sectors and levels of government and even our non-government partners. Raising the bar means more than reducing stunting. It means ensuring that every child in the Philippines, regardless of where they are born, can grow healthy, nourished, and with an equal chance to thrive. So that is all po for my presentation, and thank you very much.